This is Dr. Yoli, and my podcast today is How to Prevent Metal-Induced Autoimmunity and Neurological Disorders. I'm really excited about this one. Are you or someone you love suffering from all kinds of ache and pains? This is what I see. Joint, muscles, loss of strength, irritable bowels, anxious, insomnia, confused, forgetful, or you have been told that you have an autoimmune disorder like lupus or a neurological disorder like Parkinson, MS, ALS, or your mental capacity and cognitive is going into decline. Well, a toxic metal inside a tooth can cause hurt to much more than just the tooth. It can affect your entire body. Autoimmunity is the new diagnosis label when you're not doing well. That's like the new trend. Everything is an autoimmune disease. But patients are getting smarter than that. How can somebody in their 20s get autoimmune disease? How can somebody so young be having joint pains, hurt, and feeling exhausted? The doctors run all kinds of tests. Yes, they cannot explain why your body is attacking itself, or better put, your smart, perfect body is actually identifying a foreign focus that shouldn't be there. What is a foci? A foci is a source of infection, and this foci is the root cause of your autoimmune system. Say there's something wrong. So autoimmunity is defined as a multifaceted disorder influenced by environmental factors, aggravated by hectic, stressful schedules, genetics, pollution, aggravated by other things that you're not able to cope with. Most doctors know that metal exposure is known to be a potential catalyst. For the last 25 years, we see it daily in our practice. Mercury amalgam fillings, lead, aluminum exhibit a well-established neurotoxic effect on immune cells in your organs and your tissues, triggering autoimmune responses affecting the central nervous system, the brain. So when the autoimmune system, right, your actual healthy body, your immune system is detecting metals in the brain, is going to get inflammation on the brain, and you're going to get either MS, Parkinson, early dementia, Alzheimer's. Also, people that are diagnosed with attention deficit, autism, a lot of them have inflammation in the brain due to metal toxicity, not because they had mercury fillings, sometimes because their parents, the father, the mother, the grandmother had mercury fillings, and it gets transmitted, that toxicity, through the cells, through the sperm, in the ovaries into the baby. So this goes layers and layers. Other people get IBS. So they are always in the toilet, they're running with diarrhea, they have their stomach, messed up because the electricity that these metals have in the mouth affects actually the biofilm of the stomach. There's people with neuropathies, they have numbness on the toes, they have a lot of problems with the sciatic nerve, and all this affects different organs and even cognitive function. Very old and recent studies propose that metal-induced autoimmunity may arise from the direct toxic effects on immune cells and tissues. We have immune cells that are like all over the body, the T cells, and they're like little policemen, coupled with the impact on the gut microbiome, giving you candida overgrowth, and the inflammation and destruction of neurons in the brain caused by the metals crossing the blood-brain barrier. These effects can activate self-reactive T cells. And these T cells, they prompt the production of autoantibodies inflammatory response, and other tissue damage anywhere in the body, from head to toes, joint to muscles, to bones, is all triggered by this metal toxicity. Although the medical journals say that diagnosing metal-induced autoimmunity proves to be challenging due to non-specific symptoms, because it's so diverse, the symptomatology of the data is not being done properly, I, as a biological dentist with 25 years of experience, propose the proper removal of metals be done before the patient is treated, and then after they get the metals removed to be retested. Then it will be straightforward to prove when we see a patient with obvious metals in their mouth diagnosed with any of the above autoimmune diseases. Their test comes back, voila, negative. So once the causative metals, oral toxic loads like bacterial, fungal, viral infections, when they're eradicated from the gums, teeth, bone, and pharynx, opening detoxification pathways that were overwhelmed by all this, your perfect body, created by a perfect God, can once again find balance. It's like anything. I was inspired to say this podcast by success stories of my courageous patients who had miserable pain, different kinds of sufferings caused by metal-induced toxicity, and did not conform to taking immunosuppressive drugs for the rest of their lives, because that's the treatment that they might give you, and taking steroids. I celebrate the lives of these individuals who did their research and were blessed to have found us and received treatment to remove the oral toxic loads and feel a new sense of freedom, joy, and gratitude for a new chapter in their lives. Mrs. RH shares, my two rheumatologists for 2 years were shocked by my last blood work. After you remove my metals, showing no abnormal markers anymore, when she asked them if they knew metal-induced autoimmunity, they say, yeah, we have read about it, we studied that. But to her disappointment, she was never questioned by them if she had amalgam mercury fillings, questioned by them if she had any root canals, any fillings, any crowns that might have aluminum in her mouth, or even being referred to a biological dentist. They were trained to give a prescription, not to cure a condition, but to manage the symptoms. And that was the understanding. My patient, very happy. You know, the fact that they did not take their responsibility as rheumatologists to educate her in the possible root causes, just to give her prescriptions for drugs that she refused to take. The problem is that each drug has side effects that might be worse than the ones you have now, and they did not address the root causes. I encourage you to get educated. Start is to watch root cause documentary on Tubi app. The Tubi app is for free. For more information about health solutions, you can visit our website, gonaturaldentistry.com, or listen to my podcast, dryole.com. For a comprehensive consultation, please call, and we are heartfelt and full of gratitude, and may you celebrate a renewed health life repleted with love in this new year. This is Dr. Yoli. Subscribe to our social media, Instagram, Facebook, or just go to our podcast. Thank you so much, and have a blessed day.